I'd like to welcome the panel of familiar faces behind me, His Excellency the Governor Martin Roper, the Honourable Premier Alden McLaughlin, the Minister for Health, the Honourable Dwayne Seymour, the Chief Medical Officer, Dr. John Lee, and thanks also to Ms. Carolyn Powell, our sign language interpreter, joining us again this afternoon. So, Dr. Lee, we'd like to begin again with you, please, sir.
Good afternoon. I'd like to start by going through what sounds like a slightly complicated explanation, but it might help in everybody's understanding. When the laboratories receive a sample for the possibility of COVID-19, a screening test is run on the polymerase chain reaction machine. If this screening test is positive, we go on to do a confirmatory test. We have received back the 20 samples from CARFA that we sent, the results back from CARFA on the 20 samples we sent, which were our first 20 that we ran through the lab here at the HSA. And I'm pleased to say that 19 of the results concurred with our results that they were negative. One of them was positive at CARFA when we had previously reported it as negative. Just to give you a bit more information about that particular sample itself, the sample screened positive when we put it through the screening test, but when we put it through the confirmatory test, the result came back as negative. The patient had been the subject had been isolated at all times and remains in isolation. We will now be changing the process so that anything that screens positive will be reported as a preliminary, as inconclusive, and will then be sent to CARFA for testing for confirmation. In addition, we will continue to send all our positives to CARFA and 10% of our negatives. I also have more results to report today. I now am able to provide the outcomes for the next 22 tests that have been run through the laboratories at the Health Services Authority. We have 2 positive tests which occurred in people with a confirmed travel history. Those people have been isolated all the while and will continue to be isolated. And 20 negative tests. So by my quick count, which I've done just before we went live, we currently have 114 negative tests that we've done here at the Health Services Authority, and added to the 4 negative that were previously provided from CARFA, that brings us to a total of 118 negative tests. For the positive tests, we have 8 in total that are confirmed as positive because all of our results are moving from preliminary to confirmed now, apart from any that we announce as being inconclusive, and we still are investigating the one patient at HSA, which currently we have inconclusive results on.
Thank you, Dr. Lee. I'd like to open the floor to questions from the media. Reshma?
Thank you. Good afternoon again. Reshma Raghunath, Cayman Compass. Dr. Lee, can you tell us what has changed in this process of verification? Now, is it that you're going to be running additional tests for the results that you have from the tests that you've conducted on island? And also, can you provide us with how many outstanding tests we have on island given these changes?
Yes, so the difference is that we are now going to, the screening test that I've described is actually a far more sensitive test than the confirmatory test. So we're going to now be reporting every screen test positive as inconclusive, and all of the inconclusives plus all of the positives will be sent to CARFA for final confirmation. We will also be sending 1 in 10 of our negative tests to CARFA for a cross-check on the negatives. I don't know the absolute number of how many are outstanding. I have a rough figure here which I was presented a couple of hours ago of 51, but that number declines as we talk.
In terms of the testing that you have done, how many times have you run the tests? I know we had limited supplies of the tests on island. Can you tell us how many tests we have remaining? And I know you had ordered some as well. How many have arrived?
So we previously reported that CARFA had received some, from PAHO, we had received some reagents from PAHO, which took up our capacity, which raised our capacity, but not by that much. We currently have, I would hazard a guess, somewhere around 150, the capability to test another 150. But those are tests, they're not individual patients, because sometimes tests are run twice. If the machine shows, the machine is not, sometimes shows a funny result, then we'll put the sample back through. But that's all related to how a laboratory would normally run its processes.
Given the limited tests that we have, I know the Chrissy Thompson Hospital has offered to start testing as well. How much of a integration with those tests between HSA and the private hospitals is happening, and how much of assistance there will be to running more tests and at a faster rate?
I think it's a very exciting opportunity. I mean, the more tests we can do, it may, if we're able to test much more widely and to test many more people, it will change the way that we can manage the problem in Cayman. Our problem has been we just simply don't have enough reagents really to get the test through. So we have had to stick to a fairly rigid testing protocol in order that that we can manage our resources. If we're able to get more reagents, then clearly that can relax. And having another machine enables us to have more capacity across the board. So as you're quite rightly saying, we can test more people every day. I don't know the supplies of Chrissy Tomlinson as far as their reagents are concerned. I know that there seems to be a worldwide shortage, and that the Crown agencies have been trying to source stuff for us here in Cayman, as we're a UK overseas territory, as well as the usual procurement routes that are really quite wide that the HSA has, and we're struggling to do so. But the Doctors Hospital have been in close communication with, not only were they visited by Public Health England, so that the Public Health England experts in the laboratory have actually seen what's there, but also they're in close communication in order to try and to get there very soon. And we're looking forward to that. That'll be a great addition.
Thank you.
Good afternoon. I'm Ralph Lewis, Caymanian Times. Dr. Lee, can you give a brief explanation? What is the CARFA criteria for testing?
The criteria are actually the World Health Organization's criteria. Without reading them out verbatim, which would be terribly boring, essentially you need to have had contact with a patient who's known to have COVID-19, or a healthcare worker who's had contact with a patient who's had COVID-19, or have been travelled to a country where there's known to be local transmission of the disease COVID-19, or have respiratory symptoms that have no other explanation.
Okay, all right. Have any of the students been tested? Can you say?
I suspect some of them have, but I don't know the exact details. There are a fair number of tests that are outstanding. As you can hear, there are 51 outstanding right across the island.
Okay, the last question for you, Doctor. If a passenger has a travel history and is confirmed positive, and it's found that person passed on the virus to other members in the community, is there a penalty for that person? It's clear that that person did not follow protocol.
I don't believe there would be a penalty. If it was done knowingly, that would be slightly differently to if they were known to be infected. It's a different condition, different state than if they did not know they're infected. And if they were known to be infected, then I would. That's a very serious accusation, and I would imagine that would be considered. I would need to ask the legal department, but that is a very serious situation.
Thank you.
Thank you, Ralph. We just have one question joining us from Wendy from Cayman News Service. She's asked Dr. Lee if you could kindly break down the 8 positives in terms of local transmission versus travel history. And she's also asked about the case of the man in Honduras, whether there was any confirmation about that case, please.
Okay. So, all of the confirmed cases that we have are related to traveller incidents in one way or another. 6 of these relate to, I beg your pardon, 6 of these relate to incidents around Health City, Cayman Islands, and which was caused by people that had come to the island. And 2 of them are from people who travelled to different countries elsewhere. We still have that one case which we believe to have been a community acquired, but the test result itself is still undergoing some further investigations.
Thank you. We'll take one more
Yeah.
from you, Reshma, and then we'll move on to the other members of the
Thank
panel.
you.
Thank you.
Dr. Lee, just to clarify, the additional positive cases that you reported on today, can you say where these cases from? Is it Health City individuals or people who would have presented themselves to the hospital? Can you share some info on those?
Yeah. These are samples that public health would have arranged, not at Health City. These are two people that have had, I'm not sure of the details again, but they've either presented to the flu clinic or they've had a sample taken in the community and it's been tested in that way.
And the individuals that they would have been in contact with, have they been notified? Are they isolated? And is contact tracing being done for these two individuals?
Yes, but the people were travelers, and we have been desperately trying to get the message across that anybody who's traveled and all of their household contacts need to stay isolated in their homes, and this is exactly the reason we've been trying to say that. Thank you for bringing that point up.
Thank you.
Thank you. Kevin?
Kevin Morales, Cayman Compass. Dr. Lee, is it fair to call, if we were to call that a false negative, is that an accurate way to describe that particular result?
Yes, but it
Okay.
wouldn't. That was the first batch that we had sent. But in essence, yes.
Screening tests had been run for, that's the initial test that's given to people
Screening,
locally.
correct.
Have there been any others, just confirm, there have been no others that have been sent for the confirmation testing, which we then found out?
Correct.
So all the screening tests up until now,
The issue is all the other tests which have screened positive have come back positive in the HSA's laboratory. So there's not been that same scenario
Right.
of this particular one. It is possible that that sample was taken much later in the disease process. That sample that maybe have some influence in that particular case.
so just hearing that, the public might feel a little bit more insecure, possibly about the testing process. What would you say to people who are maybe have some concerns now?
I think the screening test is the really sensitive one, so I'm very confident about that if the screening test is positive, we're now going to report it as needing further confirmation, inconclusive, but we're going to treat the person as positive in terms of putting a ring around them and so on. And I'm very encouraged that all of the other results that came back were correct. So that is good, and I continue to have confidence in the laboratory because the experts have not only conversed but gone to visit and watched what's happened that's going on there.
Thank you.
Thank you very much. Honourable Premier?
Hello, everyone. Last night at 7 o'clock, the curfew came into effect. For the first time, I will leave the Commissioner at the appropriate point to talk in more detail about it, but I took the opportunity myself to to be driven around, I should say, not to take a drive, to be driven around part of the island to see that everything was going as planned, and an opportunity also to talk to a couple of the officers about how things were going. So that has gone very well, and I want to express my thanks and that of the government to the officers who are doing an exceptional job in very difficult and worrying times, and they have much more to do. Yesterday afternoon, I expressed some frustration at what was transpiring with respect to our efforts to put in place a shelter-in-place arrangement for the balance of this curfew period, so that everyone understands what we're trying to do and what result we are working towards. We locked down the borders of this country on Sunday evening last. The incubation period for COVID-19 is 5 to 7 days. Since then, no other persons would have come here. So what we are trying to achieve in doing what we're doing is during this period of still considerable risk of community transmission of the virus. We are trying to take every measure we can to avoid or to lower the risk of community transmission. That means keeping people apart from each other as far as possible. That means reducing groups of people congregating. That is what all of these measures are aimed at. So the curfew has the effect of essentially sending people home to their homes at 7 o'clock until 5 in the morning. The shelter-in-place provisions, had we been able to introduce them, would have been significantly reduced the number of people who are at work during the course of the day, and essentially kept people home for most of the day, just allowing them out for essential purposes a few times for the day. None of this is perfect. None of this eliminates the risk. We're seeking to try to reduce it as far as possible while allowing people to live as normally as possible. But as I indicated yesterday evening, and the numbers are still growing, we've actually closed down the essential.com KY email because we can't cope with the sheer number of requests for people to be designated as essential persons or businesses as essential services. We had, as I sit here, there were more than 850 email requests, totaling more than 20,000 persons. Now, I know our Commissioner of Police is a great guy, very able, but I don't know how he's supposed and his team are supposed to monitor that number of essential persons on the road. So as I sit here, we have concluded that at present, that is an absolutely futile exercise on our part. But our concern, which has brought about this approach, is only heightened today by two more positive results, albeit not community transmission. The number of cases in the community continues to grow. And so the government, in consultation with His Excellency and with the agreement of the Commissioner of Police, has decided that with effect from 7 p.m. tonight, the country will go into 24-hour curfew, all three islands. And so from 7 p.m. tonight until 5 a.m. Saturday morning, the country is in lockdown. During that period, between now and then, the government will continue to work on a shelter-in-place program. We are going to include the leader of the opposition in these discussions, and we hope to be able to put together a regime which the country and the people of the country, particularly the business people in the country, will support and cooperate in, or cooperate with. We need a program which is capable of being monitored by the Royal Cayman Islands Police Service without any more undue pressure than they already have to deal with. That means the program we put in place has to have community buy-in and support. I repeat, the objectives are to reduce the risk of community transmission by reducing the number of people in any given place at any given time. If we are able to put this in place and it works, we will not have to think about, again, going into a 24-hour-a-day lockdown. But that will remain an option if, when we introduce the shelter-in-place program on Saturday morning. The commissioner tells us on Saturday evening or Saturday or Sunday that this isn't working. I can't keep track of people. We are trying, for the benefit of those who may not have heard me before or have not fully appreciated what I'm saying, we are trying to get to a point where we can say with some certainty that there is none or very little evidence of significant community transmission. That, having shut down the country borders on Sunday, that means we need to get to somewhere about this time next week, maybe a little later in the week, when we can perhaps start to relax a little bit if there aren't more of these cases popping up in the community. I know, my government knows, the governor knows, the commissioner knows. We have been agonizing over this like you would not believe, that this is hugely inconvenient, hugely costly, hugely restrictive. None of us want that. But I believe all of us will agree that going through this difficult, restrictive period for the next 10 days or so is far to be preferred to many of our people getting sick, having to extend this period for I don't know how long. Looking at other countries, we're talking 12 weeks, 15 weeks, 16 weeks. Burying many of our own people and having no sense of normalcy as to how we live for the foreseeable future. If this strategy succeeds and we get to 10, 12 days from now with no significant increase in the numbers and no significant evidence of community transmission, as I said before, it would have been an incredible feat. But let's not just celebrate it for that, the possibility for that. It will mean we'll be able to send our children back to school. We'll be able to open back businesses. We will be able to have some degree of social interaction again without the fear of this evil still lurking in the community. That is the prize that I want the whole country to understand we are striving for. And we can do this together. In fact, we can only do it together because you can only govern by consent. No matter how many officers the commissioner has, he cannot effectively do the job of protection of the community if the community rejects that. We understand that. So again, I am asking everyone in this country, business owners, I know that you all are hurting. I know what this is going to do to your businesses. People in the financial services industry, you as well. You are a key component of what makes us work. But we all got to bite this bullet. We all got to suck this up for a little while to get to what I hope is the prize on the other side of all of this. And so I'm not going to go through the long list of each company that is going to be exempted from the curfew, as I did yesterday. As I said, we've had to close down the essential at gov.ky email. We've created a new one called Curfew Time at gov.ky. And if you fall into one of these categories, you need to contact the office there, go through the process, and get designated so that that list can be handed to the Commissioner of Police. I want to say that every single employee in your business, in your organization, is not entitled to be exempted. In one instance, we had one company apply for 700 exemptions. Every person in your company is not essential for the purposes of this exercise. The supermarkets are not going to open during the curfew period, neither the pharmacies, neither the gas stations. There are going to be no businesses open unless they are required for essentially emergency care. So I'll just quickly go through this list. The first list, I think I'll go through in some detail because there are some big departments and organizations that people would need to know. Police and licensed security services, 911, fire, prison service, customs and border control, Department of Environmental Health, island waste carriers, junk, emergency medical, including the HSA, Health City, doctors, hospital, and ambulance services, doctors' offices for personal emergency care, Department of Environment, the Marine Enforcement Unit, MRCU, only for the purpose of spraying and mosquito control, the Department of Children and Family Service for emergency social work only, the Weather Service, Cayman Islands Airports Authority to facilitate the continuing runway works, island paving, CAA, DVS for emergency vehicle service only, NEOC members, ministers and members of cabinet and the Legislative Assembly, the Premier's office staff, the Governor's office staff, Cabinet Office portfolio, the Office of Public Prosecution, Judicial Administration, and the Attorney General's chambers. And then utilities and infrastructure, Port Authority, Water Authority, Cayman Water Company, CUC, Flow, Digicel, Logic, and C3. Food and medical distributors, only staff for shipping, receiving, and warehouse processing. Those include the grocery stores and the other distributors. Transportation and shipping, delivery of food and medical supplies only. Food vendors and restaurants who are delivering food only. And obviously, the staff they need to cook and prepare that food. Various charity organizations that provide emergency or other care, Meals on Wheels, Cayman Crisis Center, Jasmine's Hospice, and Feed Our Future. Specialist care for the elderly and vulnerable, emergency veterinary services, those who care for animals in captivity, the press, and other media. And that is the current list. As I said, if you think you ought to be under one of those listings, please contact the Ministry of International Trade on curfew time, all one word, at gov.ky. I thank everyone for paying such close attention to these press briefings and what we're having to say. I know this is a really radical measure. The government knows it's a really radical measure, but everyone who's paying attention to what's happening in the rest of the world ought to understand why we're doing what we're doing. If we get into significant community spread of this virus in this country, it is going to have devastating consequences. It is going to swiftly overwhelm our ability to deal with it. The WHO are recommending testing. We don't have the capacity for testing. So we don't know what's out there unless someone has symptoms and comes and asks for a test. So we have to take these measures against this invisible danger because we don't know what else to do. We are trying to suppress the community transmission of this disease so that we don't get to the point where the health services are challenged the way they are in just about every country that is dealing with this. Even the United Kingdom, and you see what's happening there. And let me, as I remember the UK, I just want, on behalf of the Cayman Islands government, to extend our best wishes to Prince Charles, who, as many of you will know, has recently tested positive for COVID-19. I want to knock on the head any rumors. I saw one start to bubble up this morning. Myself and a delegation met with Prince Charles in February at his home, one of his homes in the UK. So that everyone knows what the timing is, today is exactly 1 month since we met with him. I and the delegation have been home for 25 days. The incubation period for the virus is 5 to 7 days. So I think that I am as likely to have that virus as just about anyone else in the community, and I certainly would not have contracted it from him. So I hope I knock that one rumor quickly on the head. Thank you.
Thank you, sir. Your Excellency.
Yeah, thank you very much, Premier, and thank you for your best wishes for His Royal Highness the Prince of Wales, which obviously I share very much as well. I strongly support the measures that the Premier has just outlined. As we've said repeatedly, that the countries that have done best globally to control COVID-19 have acted quickly, decisively and robustly. And this is exactly, once again, what the government is doing today. And as the Premier said, this next week is absolutely critical for us here in the Cayman Islands. In fact, it's our moment of maximum danger. So we want you to stay home. We want you to limit human contact to the maximum extent possible. Because as the Premier said, that gives us the best chance on these islands to suppress any community-wide transmission out there. And that will, of course, ensure we can protect our elderly and our vulnerable. I do want to refer to the curfew last night. As the Premier said, it went extremely well. There was one arrest. I'll ask the Police Commissioner to say a few words in a moment. But I do want to thank everybody in the community for their cooperation with police officers last night. And I do want to thank the Police Commissioner and his police service for carrying that out in a highly efficient and effective way. And if we can keep that going exactly like last night, we are in very good shape, and I urge cooperation from everybody in that. Now, as the Premier said, we're going to be looking at the shelter-in-place procedures and policy, and that will be announced. And on Saturday, when the curfew ends in the morning, we are hoping it will be possible for people to visit the supermarket, visit a pharmacy, take exercise. But how that happens and how the police enforce it needs to be worked out. But that is the intention. And then the curfew, the night curfew, will continue for the 10 days. Another point of maximum danger is our supermarkets. And I want to emphasize again that today and on Saturday, there is no reason whatsoever for everybody to rush to the supermarkets. We have supplies coming in, and we have plentiful supplies. There is no risk to the supply of goods to the Cayman Islands, and this is not a hurricane situation. So I would just urge everybody to be sensible about how and when they need to go to the supermarkets, and there is no need for panic buying. I think we can take some confidence in our testing, and the Chief Medical Officer has said that. The vast majority of the tests we've done on Ireland have been reaffirmed by CARFA. So that gives us confidence that the testing we are doing is accurate, with one or two exceptions. So I would just continue to urge everybody to follow the health advice. Let's all play our part and do what we can over the next 7 days, because as the Premier said, there is a prize out there for us. And if we can avoid community-wide transmission here over the next 7 to 10 days, we probably will be in one of the best positions of any country in the world. But that depends on all of you playing your part to make sure we have a chance to achieve that. So appeal to everybody to do their bit. So I will just finish there by saying that the Chief Medical Officer mentioned the need for more testing equipment. The UK is working hard for all the overseas territories to source additional PPE, that's personal protective equipment, and the materials for the testing. And we obviously need to get it here. It's not going to arrive immediately, but plans are in foot to get that to the Cayman Islands and the other overseas territories as soon as possible. And my office is working very hard to deliver that quickly. I will leave it there today. Thank you.
Thank you. Minister for Health?
Thank you. Good afternoon. In the essence of time, let me say thank you to the students in isolation, all the residents of the Cayman Islands at home. You're making us proud with your patience shown. And again, these measures are necessary and will be difficult for all of us. And it will pain a little, but we will gain a lot more. We're trying all we can to source what is needed in terms of equipment for frontline and for frontline staff and patients. The countries who were friends in crisis are also in crisis. So at times we are at their mercy. Hence the reason we are taking all these measures to keep our positives to a minimum. Just want to say, may God guide and protect these Cayman Islands. Great and marvelous are thy works, O Lord. All our ways are under your eyes. You hold all powers in your hands. In you there is a mercy and love. You're a miracle worker. Shower your grace and tender mercies on us. In Jesus' name, amen.
Thank you, sir. Was there anything else you wanted to add before I'll invite the Commissioner to give us an update on the curfew situation from last night? Commissioner?
If I might just say something, I'm getting, my phone is blowing up here. Because I said 24-hour curfew, I said 24-hour a day. That means when the curfew starts at 7 p.m. this evening, it will continue through 5 a.m. on Saturday morning.
Okay, good afternoon, ladies and gentlemen. Just in respect of the curfew last night, a brief or a summary update. It went very well, and I, on behalf of the RCIPS, thank the people of the Cayman Islands, and that's right across the three islands, including Cayman Brac and Little Cayman, for their almost total cooperation last night. No incidents to report in Cayman Brac, no incidents to report in Little Cayman. Last night we encountered 3 breaches of the curfew order. 1 was dealt with by way of arrest, and 2 other persons are warned for prosecution. During the course of the night, we had significant additional high visibility uniform patrols operating throughout the islands. We encountered 42 persons travelling to and from workplace. They all had identification and letters from the respective employers, and they were all essential employees. So we're very, very pleased with the enforcement efforts last night. And again, I think it's down to the cooperation and the understanding by all members of the community of the place we are in at this particular time, and the requirement for containment at this critical time, as highlighted by His Excellency the Governor and by the Premier.
Thank you, Commissioner. In light of the announcement today and the 24 hours curfew, and the Governor touched on it, the panic buying, I'm sure there are going to be people who are going to be racing out to try and get food that will run them over the next 24 hours. Will your police officers be out there to provide support to ensure there's crowd control and there won't be any sort of untoward incidents as people may head out there to try and get in before the curfew?
Okay, thank you, Reshma. So during this particular time, we have significant additional uniform patrols out, and since early this morning we have had significant additional uniform patrols. At 2 p.m. today, significant additional patrols will be employed. in the vicinity of banks, supermarkets, petrol stations, and general patrolling to assist in the community confidence aspect and assist people going about their business. We are 5 hours away from curfew from 7 p.m. this evening. We all anticipate increased activity as people prepare for what will be a total curfew from 7 p.m. this evening until 5 a.m. on Saturday morning. And I'm asking you to remember the context of the framework, the legal framework in which it operates. It still continues for the 10 consecutive nights, one being last night, finishing on Friday morning, the 3rd of April at 5 a.m. But as part of my function within the legal framework, I have extended the hours of the curfew. And as the Premier has outlined, we commence total curfew from 7 p.m. this evening, which is 5 hours away, and we'll continue right through till 5 a.m. on Saturday morning. The situation will be reviewed constantly. I will be in constant communication with His Excellency the Governor, and we'll assess. And I ask for the continued cooperation of the community to work with us. We will get through this working together, and I'm really very pleased with the way that everything went last night. Everybody that was encountered by the police, I'm advised from my patrol officer on duty, they were all very understanding of being stopped and questioned by the police, and very pleased with the level of enforcement that there was. And as I said, we will continue to enforce everything with a reasonable and fair approach, but in no liberal way. It's not going to be liberal. And as the Premier says, we have to get this total lockdown done, and then on Saturday morning review where we are, and hopefully we're in a much better position then to allow business to be conducted outside of the curfew hours, which will continue until Friday morning, the 3rd of April at 5 a.m.
Thank you, Commissioner. Now, in light of the change of the hours, the penalties are still going to remain the same, or is that going to be subject to review as well?
No, the penalties are prescribed for in law. They remain the same. I can remind there is a power of arrest without warrant by a police constable for somebody who contravenes that. I'm hoping that's the last resort. And as I said, there was one arrest last night. That happened to be a person who turned violent when they were confronted. We dealt with that, and that person will be going to court shortly. The other two persons then understood, accepted the lawful orders, and they will be dealt with at a later stage. They'll be summoned to appear in court for breach of curfew. The penalties, and I have, I think, previously outlined $3,000 Cayman dollars to a term of imprisonment not exceeding 1 year, or indeed to both in serious cases.
Okay, and for clarification, this curfew means that everybody stay put in their home, correct?
Absolutely, and I'd like to maybe just mention one or two things. So we commend the students for the way they've been behaving themselves down below in Margaritaville and in the Comfort Suites. That's going extremely well. Young people, and being totally responsible from what I can see and the reports I'm getting back. There is small movement, inter-island movement, and just to explain, that is absolutely prohibited. There are reports of people moving around by means of marine. I'm asking people not to be in the water during those hours. That the curfew applies throughout the Cayman Islands, and that includes inter-island movement between here Cayman Brac, here Little Cayman, and conversely moving in the other direction.
Thank you.
My question is for Premier McLaughlin. Is there a list available? Can people go somewhere on a government website and see some of the industries and organizations that you named earlier?
Absolutely. That will be available very shortly. Eric, help me. What's the website?
gov.ky/coronavirus.
gov.ky
gov.ky
/coronavirus. And I just want to follow up on one, I guess, profession that you had mentioned yesterday, but not today, which is domestic helpers and nannies. We've already had people kind of reach out to us about that. Can you clarify their status?
If you have a domestic helper who is staying with you, or you want your domestic helper to stay with you for the duration, that's perfectly fine. But there is to be no movement about. And I'll just add, we're still getting inquiries. all businesses except those which are exempted are shut down. They are not to operate. They are not to have staff come in. They are to be shut down for the period of the curfew.
Thank you.
Just two brief questions because I'm mindful of the time frames. Will there be press briefings every day at this time?
Over the curfew period, yes, we will continue the press briefings. I think people will want them more during that period than perhaps even now. I'm hoping, we're praying there are no significant developments, but we'll at least be able to provide information.
Can we target 2 p.m. every day?
Subject to circumstances, yes.
And the final question for me is, can you reiterate what you're trying to achieve or what the country is trying to achieve by this drastic measure of a shutdown for 3 days?
We are trying to prevent the community transmission of COVID-19. We're trying to do that by restricting the number of opportunities people have for coming into touch with each other and to possible surfaces on which the virus might be living. In short, that's what we're trying to do. Because there is no longer the opportunity for the virus to be introduced here during the time that the ports are shut down, once we get to the end of about 2 weeks, we will have, in fact, I think much earlier than that, a very good idea where this community stands in terms of this virus among us. The prize at the end is if the strategy succeeds, we will be able to come out the other end, open schools, resume life with some semblance of normalcy. And I say that because we will have to continue to keep the ports shut down as long as the virus is raging around us. But domestic activity, domestic business, construction, banks, financial services industry, to the extent that they still have work and business, given the state of the global economy, will be able to carry on as normal, or as close to normal as possible given the worldwide circumstances. That's where we're trying to get to.
Thank you very much.
Thank you very much to everyone who's submitting their questions to us via Facebook, via social media. We've got a huge number of questions, so a reminder that many of the answers to those questions can be found at gov.ky/coronavirus. We haven't got the panel behind me for too much longer because they have vital work to be done. So members of the media, if I could ask you to focus your questions now on the issues that we've raised this afternoon. And if I could begin just by asking one question that's come up quite a lot for the Commissioner regarding the curfew, matters quite specific questions such as the penalties that are in place, are they per vehicle, sir, or are they for the number of individuals that are contained inside the vehicle? So could you have a question, a case where you have 4 people and it's $12,000? That's a question that's blowing up my phone, blowing up social media, so we understand.
Can I afford this speech?
I'll hand over to the Commissioner.
Thank you. So to clarify that, the curfew applies to individuals and not to vehicles, so it applies to each and every person across the Cayman Islands unless exempted as an essential person, and permits will be issued.
Thank you. This question is for Dr. Lee. Just to go back to our previous conversation, a question was asked for an update on the Honduran national Cayman resident. Can you provide us with that update?
I haven't heard anything through the international channel, so I have not reached out to Honduras to find further information, but we have not had any confirmation that case has proved to be a positive COVID case.
Okay, thank you. And I know you said stick within here,
If
but
possible, please.
This question is related to the flu line. I know you've been telling everyone call the flu line with the symptoms and utilize this facility to minimize hospital visits. Can you tell us how effective that has been and how many calls you've had to the flu line?
If I might ask a representative from the Health Services Authority to take that. Thank you.
Thank you very much. I'd like to actually start by thanking the government and the public for embracing the system that we have in place in regards to reporting if you have flu symptoms and seeking medical attention. So we've been asking persons, if you have flu symptoms, to stay at home and then call the flu hotline, and the advice and direction will be given as to who needs to be seeking medical attention. And that is in keeping with the curfew that we now have in place. So again, if you have symptoms, stay at home and call the flu hotline, and that flu hotline is the same for all of 3 islands. And if you are coming to seek medical attention, you are to call ahead. So that is whether or not you're coming to the flu clinic, a private hospital or a doctor's office, or here or in the sister islands, or after hours for A&E. The flu clinic is open 8:30 to 4 p.m. 7 days a week now. And also any person who's seeking attention after 4 p.m. would go to the emergency department. But we need to know that you're coming. So if you come to the hospital, we ask you to then sit in your car and contact the flu hotline, and they will be able to channel you into the relevant service so that you do not have to encounter anybody else who is in the hospital, and will be able to have the relevant mask or supplies in order to be able to take care of you. So far, we have seen the evidence that people are complying with those instructions. We started the flu hotline on the 14th of March, and we've had 702 calls so far. These are persons who have had minimal symptoms or maybe just had queries as to whether or not they meet the criteria for testing. And we have seen 170 persons in the flu clinic. So 170 persons, and that has been since the 16th of March. So the numbers have been increasing as far as the calls are concerned to the flu hotline, and we've seen a reduction in the number of persons actually seeking medical attention. And this is good news for us because it indicates that the symptoms are relatively mild. Even though persons are feeling ill, they're relatively mild and they do not need to seek medical attention. And the flu hotline is open 24 hours a day. You can call as many times as you need. There's a caller, and we will staff that according to the demand. And this is staffed by all clinical personnel. So we've had doctors, senior nurses, senior emergency workers that are on the other end of the phone to screen your symptoms and to advise you as to how to take care of yourself.
Any further questions from members of the media? Gentlemen, any further words, Your Excellency?
Could I just make one comment at this point? The Chief Justice has asked me to make clear that Magistrates Court tomorrow, the drug court for Thursday, the 26th of March, everyone who is required to attend tomorrow should come on the 9th of April at 2 p.m. For the maintenance cases, anyone who is scheduled for Friday, 27th of March should return on Friday, the 24th of April at 10 o'clock. Persons who are subject to financial provisions and maintenance orders must make payments as ordered, and the payment details are available on the judicial.ky website or the usual phone numbers. Criminal cases, the criminal traffic cases scheduled for tomorrow, Thursday 26, are to return on Thursday 23rd April at 10 o'clock. Thank you.
Thank you very much.
And one more, if I may. If I may just make one more reminder for everybody, especially that everybody is going to be at home. Please look after the older people in your homes or the people who have got chronic illnesses. Think of them that they've got a glass wall around them and do not approach them. If they're in another room, you could consider having games, doing FaceTime or WhatsApp, but please look after them. It's those people that are most likely to have adverse reactions if they were to get COVID. So look after them and keep your hands clean and try to keep contact down to a minimum.
And you can walk outside of your house, and you can walk your dog, but not on the road.
Thank you for that clarification. Thank you very much, everyone, for joining us this afternoon. Just a reminder, the address for those seeking exemption from the curfew was curfewtime@gov.ky. That and all the other vital contact information can be found on gov.ky/coronavirus. Thank you very much.